Welcome back, everyone, and thank you for joining us. I have a few things I want to update you on, and as many of you know, the CDC had made new recommendations on Friday that everyone wear a cloth mask when out in public places. Additionally, our New Hampshire Department of Health made the recommendation that anyone entering any healthcare facility also wear a cloth mask. So I wanted to let you know what we've been up to all weekend and what's happening at Dartmouth-Hitchcock facilities around the state. So as you know, we're learning a lot every day about coronavirus and how it's transmitted. And the reason these new recommendations were made for masking is because we now know that people without symptoms can actually transmit the virus. This can happen days before they develop symptoms, or people may carry the virus and never develop symptoms. And so the recommendation to mask is really to prevent the transmission of virus from someone who doesn't actually even know they have it to those around them. Obviously, the most important thing that we continue to stress and recommend is social distancing. So keeping that 6-foot distance from other people is really a very good way to prevent transmission. But if that's not possible, that's where masking comes into play. So I wanted to tell you a little bit about what you're going to see and what masks we have here at Dartmouth-Hitchcock and when and how they should be worn. I wanted to start with the cloth masks, and most importantly, thank all of our mask makers for making these masks. We have received many donations, and now with this new universal masking recommendation, we're going to need your help more than ever. So keep sewing. This is a cloth mask. This is homemade, and we have lots of good guidelines about how to make them, with what to make it with. And I wanted to show you how it should be worn, because I know not everyone knows how to properly put a mask on. These cloth masks here at Dartmouth-Hitchcock are being recommended for any patient or visitors entering the facility. You will see these being handed out at all entrances upon arrival. You should take the mask and make sure it's fully open, and place it over both your nose and your mouth. The loops then need to go around your ears. So when taking off a mask, make sure you're always grabbing it from behind your ears forward. That way, if anything has contaminated the outside, you're not touching the outside of the mask. Again, this is for patients and visitors. We do not recommend these to be worn by our healthcare providers, because we don't have a lot of data on the efficacy, and what we know is that they are less effective than medical grade masks. For all of our staff entering the facilities, it may be clinical staff and non-clinical staff, we recommend the use of a medical mask. This is a medical or surgical mask, commercially produced. It can come in various colors. So right now you see that this is a blue mask with ear loops. It has a wire across the top. I want to make sure you realize that the wire goes across the nose. This is the part that should be up. The bottom does not have a wire. When putting it on your face, make sure it covers both your nose and your mouth, and pinch the wire to secure it to your nose and loop the loops around your ears like this. Again, make sure it fits securely over both the mouth and the nose. Wearing a mask like this does not properly protect against transmitting virus, so you really need to make sure it's over nose and mouth. I wanted to show you one more type of mask that you may be seeing worn by our healthcare providers. This too also comes in various shapes and sizes and colors, but this is called a respirator. This is meant to be worn for the care of suspect or confirmed COVID-19 patients. Again, we have various types. This is just one example. We also have kinds that are reusable and rewashable that are made of rubber that you will also see. This again requires to be put over the nose and mouth. And employees need to be properly fit tested for these because they come in different shapes and sizes. This one has 2 elastics, and both elastics need to go over the head. Again, the metal needs to be pinched tight around the nose, and it must cover both the nose and the mouth. On Friday, we recommended that all employees providing face-to-face care with patients universally wear a face shield. This goes across the entire face by putting it on the forehead and strapping it around the back. Again, you may see different types of these as well. There's ones that look like helmets that are placed on the head and the shield comes down in front. This is to protect our employees from acquiring virus, again, that may be shed from someone who does not know they have the virus, to both protect their eyes and their face. This now is recommended in addition to the masks that will be provided. We hope that with the use of the combination of face shields and masks, we can universally protect all of our employees from any exposure to COVID-19, whether that be from patients who don't necessarily know they have it, or from our own staff who may also not know they have it. I think it's important to remember that when caring for COVID-19 patients, we have a separate set of personal protective equipment that our staff have been very explicitly trained to, and that the masks received at the door need to be taken off and the proper PPE put on during patient care. We have a hotline that we continue to staff, and if there are any questions regarding what kind of masks and in what settings to use them, we have developed multiple policies and procedures with details of what I should wear when, because I know this is becoming confusing with the various types of masks and shields available. So there have been several questions as to whether or not healthcare providers should be wearing the cloth masks over the medical grade masks in order to preserve the lifespan of that mask. This is actually not necessary with the face shield. So if you're wearing a medical mask, the face shield will protect the mask that you have on your face, and there's no need to wear a cloth mask in addition to the medical mask. In addition to masks, you'll see that we are also giving out brown paper bags. This brown paper bag is meant to be used to put your mask in when you are eating. So we recommend taking it off and putting your mask in the bag so that you can reuse it at a later time. As a result, in addition to donations of masks, we are requesting any donations of paper bags. That way we can reuse the masks that we have. Additionally, the cloth masks that are being distributed to our patients and visitors can be kept if you'd like to take them home. If not, there are bins at the entrances so that on your way out, you can deposit them in the bin for us to rewash, recycle, and reuse. I wanted to say thank you to our incredible staff, both our clinical staff taking care of our patients as well as everyone that's keeping the hospital running during this very dynamic time. I also want to thank all the people that have been donating supplies to us. We continue to be incredibly grateful for your time and your donations, so we thank you very much. Please know that you can call our hotline with any questions at 603-650-1818.